Trump's vascular diagnosis, what it means for your legs too. Recent reports suggest former President Trump is dealing with a leg circulation problem. While we respect his privacy, this news gives us a chance to talk about something that affects millions of Americans every day. This same leg problem might be happening to you right now, and there's one simple sign most people ignore that could save your legs. Stick with me because what I'm about to show you could mean the difference between healthy legs for life or serious problems down the road. I'm a trained pharmacist and a trained PMHNP. I've spent more than 10 years helping people understand their health problems and find real solutions that work. When someone in the highest office deals with health issues, it reminds us that our bodies don't care about our job title or bank account. Health problems can happen to anyone, and that's exactly why we need to talk about this. In my years of practice, I've seen too many people ignore early warning signs. Today, let's use this moment to learn something that could protect your health for years to come. What is chronic venous insufficiency? The condition we're talking about is called chronic venous insufficiency. It's when the veins in your legs can't pump blood back up to your heart the way they should. Think of your leg veins like a one-way highway. They have tiny doors called valves that open to let blood go up, then close to stop it from flowing backward. But when these little doors break, and I'll tell you the main reason they break in just a minute, blood gets stuck in your legs like traffic in a jam. This creates pressure. Too much pressure damages your skin, causes swelling, and can lead to serious problems if you don't fix it. How common is this problem? Remember when I said this might be happening to you? Here's why. Over 25 million Americans have this problem right now. That's about 1 in every 12 people. And that simple sign most people ignore, it's something you've probably felt but never thought was serious. The scary part is, most people don't know they have it until it gets really bad. They think their symptoms are just part of getting older. Who gets this condition? So why do those tiny doors in your veins break? The main reason is pressure from standing or sitting too long. And that warning sign everyone ignores? Heavy, tired legs that feel like concrete by the end of the day. But there are 3 things you probably do every day that make this problem much worse. Number 3 will surprise you because almost everyone does it. If you have a job where you stand a lot, like teaching, nursing, or working in retail, you're at higher risk. If you sit at a desk all day, you're also at risk. Being over 50 increases your chances. So does being overweight, being pregnant, or taking birth control pills. If your parents or grandparents had bulging veins in their legs, you might get them too. The 4 stages of progression. Let me tell you about those 3 daily habits in a moment. First, you need to understand how this problem gets worse over time. Stage 1. Your legs feel heavy and tired, especially at the end of the day. They feel better when you put them up. Stage 2. You start seeing swelling around your ankles that doesn't go away when you sleep. Stage 3. Your skin starts changing. You might see dark patches, itching, or rough spots, especially around your ankles. Stage 4. Open sores that won't heal. This is dangerous because these sores can get infected. Here's something important. You can't go backward through these stages, but there is a way to stop them from getting worse, and I'll show you exactly how. What makes it worse? Now, those 3 daily habits that make this problem worse. Number 1, crossing your legs when you sit. This cuts off blood flow and adds pressure to your veins. Number 2, wearing high heels often. They stop your calf muscles from pumping blood up your legs properly. Number 3, sitting on the toilet too long while looking at your phone. This squatting position is terrible for leg circulation, and most people do it every day without thinking. But here's the good news. If you catch this early, you can stop it from getting worse and even make your symptoms better. Simple solutions that work. You can't reverse damage that's already happened, but you can protect your legs starting today. Here's how. The 20-33 rule. Compression socks with 20-30 pressure. Put your legs up for 30 minutes daily and walk 3 different times throughout your day. But most people make one big mistake with compression socks that makes them useless. I'll tell you what that is in just a second. Every hour, do 20 calf raises and 20 ankle pumps. This helps push blood up your legs against gravity. Before bed, lie down with your legs higher than your heart for 15 minutes. Do slow ankle circles while you rest. That compression sock mistake? Most people put them on after their legs are already swollen. You have to put them on first thing in the morning, before you even get out of bed. And they have to fit right. Wrong size makes them worthless when you need medical help. If you already have skin changes or open sores, you need more than just compression socks. There are procedures that can help, but timing matters. If you have dark patches on your skin, sores that won't heal, or severe swelling, see a doctor right away. There are treatments like laser therapy that can seal off damaged veins. These treatments work best when done early. Wait too long, and your options become limited. Daily prevention protocol. Put on compression socks before getting out of bed. Take a supplement called horse chestnut extract with breakfast. It helps reduce leg swelling. During the day, do calf exercises every hour. Don't sit or stand in one position too long. Wear comfortable shoes with good support. Never cross your legs. Evening. Put your legs up for 20 minutes. Gently massage them with witch hazel gel. Do ankle pumps before you sleep. What to buy? Look for medical-grade compression socks, not cheap ones from the pharmacy. Horse chestnut extract should say standardized to 16 to 20% acin on the bottle. Witch hazel gel can help with burning or itching feelings. But how do you know if you need to start doing all this? Let me give you a simple test. Always ask your pharmacist before taking new supplements, especially if you take heart medicine or blood thinners. Self-assessment test. Give yourself 1 point for each yes answer. Do your legs feel heavy or tired by afternoon? Do your ankles swell up, especially at night? Do you see any dark spots on your lower legs? Do you have visible bulging veins? Do your legs hurt or throb at night? Do you get leg cramps, especially at night? Is the skin on your legs itchy or rough? If you scored 0 to 2, you're probably okay, but start preventing now. If you scored 3 to 4, you have early signs. Start treatment right away. If you scored 5 to 7, you need to see a doctor soon. Important facts to remember. This problem doesn't get better by itself. Every day you wait, more damage happens. But the good news is you have control over this. People who follow the complete plan see their legs feel lighter, less swelling, and better sleep within 4 to 6 weeks. Don't wait for open sores before you take action. Don't think bulging veins are just cosmetic. Don't ignore skin changes thinking they're normal aging. Going back to President Trump's situation, when someone with access to the best doctors in the world deals with this, it shows us that this condition is serious and common. It reminds us to take our own health seriously too. When to see a doctor? If you scored 3 or higher on the test, if you have any open sores, if your symptoms don't improve after 2 months of treatment, or if you have sudden severe leg pain, see a doctor right away. Begin the prevention plan today if you're at risk. Get proper compression socks fitted this week. Take movement breaks every hour at work. Put your legs up every evening. Keep track of how you feel to see if you're getting better. Remember, every day matters, but with the right steps, you can keep your legs healthy for life. This isn't just about one person's health journey. It's about all of us taking better care of ourselves and the people we love. Let's review what we learned today. Chronic venous insufficiency affects 25 million Americans when leg vein valves fail from too much pressure. Early signs include heavy legs, swelling, and skin changes that progress through 4 stages. The main solutions are the 20-33 rule with proper compression socks, hourly calf exercises, and daily leg elevation. Avoid crossing legs, wearing high heels, and prolonged sitting. Take the 7-question assessment to know your risk level and start prevention immediately if you scored 3 or higher. If this helped you understand leg circulation better, hit that like button and share this with someone who needs to see it. Your legs depend on you taking action today. Subscribe for more health education that could protect you and your family. Watch my next video about telling the difference between leg swelling from vein problems versus heart problems, because getting this wrong could be dangerous. Take good care of your legs. You need them for everything you want to do in life.